what I did not know is that in pregnancy, these baby imposters become bigger in size because of the pregnancy hormones. That bit I did not know.
Yeah, that's what I ate. I just said, shrimp. My Oga skizzard. My
Hi guys, it's Didi here again, and today I'll be starting another series on Didi Snook. Thank you all for the engagement on the last videos and the last series. Thank you, God bless you. Today I'll be talking about a particular thing, an experience during my pregnancy. I will not be talking about the details, like the highlights. For the highlights of my pregnancy journey, there's another video. I'll be putting the link in the description, so you do well to check it out. It's on Nourish and Nurture with Adira, right? But today I'll be talking about a particular experience. I mentioned this in the video. I termed it as the medical condition. So I'll be talking about that in this video. Sometime in 2021, like ending of 2021 or early 2022, I had to go to the hospital because I wasn't feeling 100%, and then I had to run a scan on me, and then they discovered a case of multiple fibroids. Yes. At the time, it wasn't anything big because I think the biggest they saw was between maybe 7 to 10 centimeters. I think that was like the biggest they saw at the time, or he saw at the time. But it didn't make it look like it was something that was scary, or it was a big thing at the time. I told my partner, my now husband, and then told my friend, a few of my friends and sisters, and then of course my parents knew, and then we continued praying about it, and life went on. Then I came to the UK, and I had to tell the GP or tell the hospital about it. They did a scan too, and then they discovered, or they also said there was a case of that and all that. And then I was put on the surgery list, at least to take out the big one. Then I'd asked that, would it stop me from conceiving? And they said, no, there are a lot of people, most women, or some women, let me put it like that, have fibroids, or that have fibroids, don't even know they have it, and then they go about life normally, you see. So I was put on the list, and then we started trying for a baby end of 2023. I did a few tests, like pregnancy tests, and then it was negative like towards the end of the year. And then 2024, I can remember speaking to one of my friends, and then she said at them that March would be the last month to conceive if I'm planning to have a baby in 2024. And yeah, which was right, or which is right, because I mean, by calculating the months, March was the time that if you have to add 10 months, you know, to have a baby, 2024. Sometime in February, I did, like early February or is it late January, I did a pregnancy test again, and it was negative. And then I just put the pregnancy stick in my drawer. Then I was supposed to see my period, and then it was late. It was just late by maybe a day or two, see. But before then, like say some 3-4 days before the dates that it was late, I saw my mind was in the pregnancy. My mind kept going to the pregnancy stick, and then I went to check it. Okay, no, I didn't go to check it. When it was late, when the period was late, then I went to go and check. Like the day I felt like, as my parents were supposed to come yesterday or the first day, I went to go and check the pregnancy stick that I saw. So normally it's supposed to be 2 lines. I saw one very clear line, which was what I saw at the time that was negative. And I saw a very faint line. And I'm thinking, is it that because it's been a while? Is this true? Is this maybe something scratched it? I check. At the time, my husband we're not living together in the same city. It was with me. We're not living in the same place, but of course, he used to come and then go. Yeah. So he wasn't there at the time. So I had to go to the hospital because of this discovery of theirs. I think in preparation to whether or not I would have the surgery. And then after being seen by the attendant or the doctor, I think, I kept saying that I had questions, like I wanted to see a consultant to ask but some questions about conception and all that. So of course, I was allowed to see him, and then told him that I had to do a test, like urine test. I think it was protocol. It feels like years back, but it's not so long ago. And then I did the test. I took the urine test, and then I was in his office, and I think the attendants or the people that work with him went to go and run the test. So I was there, and we were talking about the old, in quotes, baby imposters. That's what I call them, baby imposters. When they brought the result, they wrote it on a piece of paper. They just wrote something. The lady passed it to the second lady. The second lady passed it to him. Then he said, "Do you know you're pregnant?" I'm like, and that's how I found out for sure that I was pregnant, you see. And he said I had to come off the surgery list, and that was it. I was pregnant. And then what I did not know is that in pregnancy, these baby imposters become bigger in size because of the pregnancy hormones. That bit I did not know. I mean, I knew the case of it could shrink and all that, but I didn't know about that, and I wasn't told that. And to be fair, did I really research about it? No. So I didn't know that bit. And then I went on with life, you see. And then the 12th or 13th week into the pregnancy, I just went to the toilet, and then I saw that my poo was red. Of course, I started reading, but not about the baby imposters, not about whatever they saw, about pregnancy, what to look out for, when to call your GP, and all that, you see. I started reading, researching, asking questions about that one. So when I saw it was red, of course, I was not bleeding, but I had to call the GP, like this is that. And in the UK, anything about a child or an expecting mother, come in. So I went in, and then while I was there, I started feeling pains in my side, like my right side, my belly, the right side. I started feeling, I knew that they said in pregnancy sometimes there could be cramps, but I wanted to know, is that what it was? It was painful right there, you see. It wasn't anything, it wasn't an emergency, so I was just in the waiting. And then the pain started getting more. I started throwing up right there. I could not stand well, you see, and they had to just put me on admission.
Okay, so I started feeling that sharp pain, and I got admitted, like I said. And they said what was happening was red degeneration. So in simple terms, the baby imposters got big. So they grow. So like I said, they grow rapidly in pregnancy. And then at the time, they said it was like the big one that was not up to 10 centimeter. At the time when I found it was about 17 plus centimeter. And then so they grow really big, and because they don't have enough blood supply, then some tissues start to die. So it's that process of degeneration that is happening, and that's where the pain was coming from. And so it could just be managed. I mean, at that time, for pregnant people, they can't take a lot of drugs or medications, as it were. It's just like maybe paracetamol, some pain reliefs. You cannot take certain medications. So I was there on admission, and then, like I said, the pain was coming and going. But that midnight, I wanted to go and ease myself. And then I discovered that when I move my leg, I would feel that pain. Of course, I was still. This was around like maybe it was just early in the morning, like it was midnight. It wasn't even up to 5 yet, I think. And so I just stood still. I wanted to ease myself, but that pain, I didn't want to go through it. So I just, but then I became very pressed. And then I rang the bell for the nurse. And then when she came, I told her that I was pressed. I wanted to ease myself and I was feeling this pain. And she told me, oh, just go. Just go. I'm like, okay. Then I moved the leg. My brethren, the speed I used to return the leg was more than. And then this sharp pain that was coming and going became intense. And then instead of it to go, it was there. I used to be very cautious of my environment. I like to, make sure everybody is fine, that kind of a thing. This time it was in the midnight. And of course, it was not a private ward, so there were still other people. It was like it's like 3 more people. I think it was a four, either 4 or 6. So there were other people in the ward. I was screaming, God help me, help me, God help. I was screaming and sweating. They had to wheel the bed to a side room, like a single room. No, that pain was excruciating. And then my husband wasn't there. Of course, he was on his way. Was on his way. Because since I became on admission, and then I told him he had to leave what he was doing to come. But he wasn't at that. It was early. Even if he was around, it was early. They don't allow somebody. They don't allow people to sleep over. So it was early. It would mean that it was probably just getting ready to leave the house. I was let it help me take this away. Let this go away and all that. They could not give me so much. I think they gave me a shot of morphine at the time. Then they gave me this gas thing that they give people in labor. You see, and paracetamol. And I was there. And after about an hour, the pain started subsiding. At that time, I was already tired. I don't know if it was the gas and the gas thing. I was already looking like I was floating. I was tired. And from then, I could not stand well. I could not sit. I could not eat. I was throwing up. Like I'm not even times when I don't eat, I will throw up. I felt pain. I felt pain. The next morning during the ward round, the consultant came, and then she, of course, after the how do you feel and everything, do you know there was this, that, and all that. She did say that she told me about the risks of what was going on, of continuing with the pregnancy. You see, like the pregnancy was now termed a high risk pregnancy that needed close monitoring. And she told me things that could go wrong during the pregnancy. Because the baby imposter was big. My stomach was, it wasn't like I had so much, a big belly. There was my stomach, the baby was growing. See, and then she said, as that is that size, then the baby growing, it could, affect the organs, my kidney and all that. And then there was also the case, the instance of a miscarriage happening, you see, and then the baby being deformed because of maybe they had to push on something. She just mentioned a quite number of things, and then also said, but if I continue, she just said it shortly like that. So she didn't say anything. She didn't. I sensed what she was trying to say, but she didn't say it like that. She just told me the risks, and then said if I wanted to continue, they did to support me and all that. And then she left. And then Another consultant came another time. Of course, my husband wasn't there. So it's not like my husband wasn't, because you cannot have your partner or somebody sleep over in the hospital with you. See, so there's a certain time they had to leave that place and then come in the morning if you're coming. So at that time during the ward rounds, my husband wasn't yet in the hospital. You see, so when this consultant came, she asked me my age, and then I told her. She said, "Oh, that's beautiful that you're very young, that you can try again." So she said, she came from the point of she knows that mothers like to hold on to these things and oh my child and all that. But then I shouldn't be selfish. You see, I should think of the health of the child. I should think of what could go wrong. I should, um, like you said, I wasn't young to try again. I wasn't too old to try again. That with all the risks, so she also made mention of the risks, and even quite a number more because of the positions and all that of the imposters. And she said that it would be a wise decision to terminate the pregnancy. At the time, it was 12, 13 weeks, and she said that I didn't have to even do surgery if I was going to take it out. That they were just going to do something because it wasn't like fully formed yet. And she said that, and she was going away. Before then, I think before this consultant came, I think after that first consultant, I knew, like I said, I sensed what she was saying. Then I took a particular book with me to the hospital. I was reading Supernatural Childbirth, and I took it with me to the hospital. So it was there with me on the bed. And when that person said all that, and also the pain I was feeling, of course, I called my husband and told him what was said. And he told me, and he told me, don't worry, you will have your baby. You will have your baby. I shouldn't tell my parents yet what that consultant said. So at the time when this consultant was coming, to be honest, I thought about it. I thought about what that first person had said because truthfully, I was going through pain. Pain. I couldn't eat. I was throwing up. I couldn't sit. I couldn't sit like comfortably. I couldn't lay on my side. I couldn't walk. Like I couldn't even stand straight to walk. I felt pain, I know. And of course you cannot have so much. You cannot take medications. There was just little, just paracetamol and some other pain relief that is allowed during a pregnancy that wouldn't affect you or the baby, especially the baby, see. So there wasn't much to do at the time. So yeah, I felt pain, and then my husband said that, and somehow I just felt strengthened. And when this consultant came and said, you will okay, this is what's going on, the risk and everything, and then we can end this and then you will try again. She made that, of course she didn't say that's what's going to happen, because at the end of the day, any decision you make, any decision is yours to make. You see, they're not going to tell you do this. They will tell you the options, they'll tell you the risks and everything. You make the decision. So, but she made it look, it sounded like the wisest thing to do, given everything that was going on. And when she finished saying it, it felt like she had said a bit. I should think about it with my husband, and she was turning back to go. And I said, I called her back, like, is that? And like, yeah, she's giving me time to, like, would see maybe the next morning or something that I should speak to my partner or speak to my husband about. And I said, I have my response, I have my decision. Like, oh, what? Like, I would go ahead with the pregnancy. She looked at, of course, when they're doing ward round, it's not just that consultant. She would come with some attendants and maybe some interns, I would guess. So she looked at the attendant. That one looked at somebody. They looked at each other and said, "Is that what you want to do?" And I said, "Yes." And I said, "Okay. That's good luck or best of luck and everything. We'll see you and all that." And I could hear them talking, but I wasn't hearing what they were saying. And then they drew my curtain, and then I could hear them talking like behind the curtain and all that. And then they went, see. And then of course my husband came, we spoke about it. I think the next day, I wanted to speak to another consultant. So I told them to call somebody for me. It was a man this time. And then when he came, I asked him that, okay, I was told this, I was told that, and everything. That what would he say, or what would like maybe advice? Again, my husband was not there, but I had to call him, so he was on the phone with him. So anything I was not asking, my husband could also ask. Anything I was not remembering, or I didn't remember to ask, my husband could ask. So I can remember the man said that everything they had said is true. Like there are risks associated with going on with this pregnancy. Like I said, it was termed a high risk pregnancy. It could, I mean, everything they had said, you see. But then he asked me if I conceived um, naturally. And then I told him yes. And then he said, while it's true that you will not need surgery to take out this pregnancy, if you're going to take it out now, when they want to take out the baby imposter, it's going to be like a normal cesarean section. And for every surgery, there is a risk associated with it, whether it's bleeding or whether it's on the womb. You see, and so what if I take it out, and then of course I would have to heal and then try again. By the time of trying again, it becomes difficult to conceive. So he said this came naturally. That how about you do everything you can to go on with this pregnancy, like do what you're supposed to do. Like all these things they are saying are risks, but they are things that could happen given the situation, but they are not things that are happening. They're not happening. That so why not continue monitoring it? Continue like go on with this pregnancy. Do what you can. If there is if there now comes a case of miscarriage, you know that you did everything that you could to go on with this pregnancy, and then you deal with it at the time. But that we should, so it felt like I was saying we shouldn't use our hand to take it out now, because nothing is at that time, nothing was physically going on like what was going on real time that called for, that was concerning, you see, or that called for immediate intervention. That continue with it. If anything now happens, you know that then would go on with it as it comes. So yeah, he said that, and that also, you see, strengthened me. And then we went on with the pregnancy. The pain got better. I got discharged. I got home. When I got home, my cousin, at that time, my husband wasn't here because he was working in another city, you see. So he couldn't stay per se. He wasn't working remotely. He had to take time off, you see. So he had to go back. But my cousin, when I was discharged, my cousin was with me. I remember that day, I got home, and then I think I wanted to brush my teeth. And at that time, I was throwing up. I couldn't take water, like normal tap or normal water. It had to be flavored water. So brushing my teeth also, I would throw up and all that. So coughing too was painful. Gosh, laughing. Oh God. And so I wanted to ease myself. Like I said, sitting was the thing. So I think I was trying to stand up from the toilet. So that pain. I think it was the day I came or the next day. The pain that I felt that I returned my leg. That's how the pain came. I screamed. I just started sweating. I stood there. My cousin came. He held me there. I held him. We stood for some minutes there. I was sweating. I was just saying, God help me. No pain, no this. I was just there. And then, of course, it subsided. Life went on. And sometime in my third trimester, I felt pain again. And then it was still the degeneration. And I had to go to the hospital. I was on admission. The first time I was on admission for about maybe 2 weeks, I think. This time I was on admission for less. Like it was also some days, but I don't think it wasn't as long as the first time. But I was also on admission. Of course, during the whole process, I kept seeing my doctor, my consultants, like more than every other mother or expectant mother, because of it being termed a high risk pregnancy. So my hospital visits were more. See? So, of course, when it was getting closer, they were talking about it's for the most part of the pregnancy was it felt like I was going to have a uh complicated birth. You see. So of course there was a talk of it being a cesarean section, like to take out the baby if the baby comes to term. And then we were doing that. I would do tests during the pregnancy. There was this okay, before then I was being treated for, or I was taking medication for um iron deficiency, like anemia. That was on that. And then during the pregnancy, I started taking aspirin also. They said there was the case of low papae, where the placenta to the child, there was something with it, you see. So I needed to start taking aspirin for the low papae. At some other points, I needed to do a gestational, this glucose test. And then they said there was a case of, so while I was seeing the consultant, I was also going for my normal visits, normal antenatal visits. And then they said there was, so during that visit, they said there was a case of gestational diabetes. And then I went back to my consultant. Of course, it wasn't like, oh, you do this and they say go to your consultant. They said that they will tell you what to do next. But when I went to my consultant and then she checked the result, she said that number was fine. That it wasn't there is no gestational diabetes, you see. So that one was dealt with. In the pregnancy also, there was the screening for Down syndrome, Edward syndrome. And then um, when the result came, like I mean the normal visit, they said there was 1 in 5 chance that the baby had Down syndrome, blah blah blah. I went my when I had the next consultant visit. Of course, they said I had to do an advanced test. You see, but before the result of that came, I had my consultant visitation, and then I told my consultant what was said, and she checked it and said, no, that there was there was not a case of that, but that we should wait for the final result. When that came, it was fine. You see, that went on. At some other point, they said my amniotic fluid was more than it should be. You see, which was, I think, it would mean that the baby would come early and all that. When I had my consultant visit me, trust me. So as I was were saying that, and then they'll continue whatever they needed to do. But when I have my visits with the consultant, I would also mention what they said. You see, so to see. So I just kept asking questions like that, left, right, and everybody I could ask. Well, she also said that was like it could. Was it actually more like he said it was just fine. I think so. Yeah, that was just by the way. There were just things that happened in that pregnancy that things just kept coming up, and as they were coming up, they were coming down, coming up, coming down. Yeah, but yeah. So in my third trimester, I felt the pain again, and then I was there, and then when it was getting closer to, of course, I had my birth plan. It was the CS thing, and then we're speaking about that and all that. When it was 30 weeks, and I went to see my consultant, she told me, because I can remember when I first met with her, our first meeting with her, like who was going to be my consultant. She told me, just like every other consultant has said, everything, and then like she has seen people with fibroid that truthfully, this one, like the big one, the big imposter they were saying was quite large, because the one she dealt with maybe not so long before then, that the woman, that the baby imposter was about 13 centimeter, and the woman had a baby around 33 weeks. Because I mean, I asked her if she had dealt with a case like this, like was the, I mean, most of those consultants were saying if the baby could go like push through a particular date, like when the baby is 28, is it 28 weeks? They said it's 24, 20, that the chance of survival of the child is high. Like if you give birth to that child at that time, then the chance of the survival of the child is high. But if it's before that time, the things could go wrong with the child. So I was asking the doctor about the consultant about that also. I said that woman had a baby around 33 weeks. See, and that although whatever they were saying, the baby imposter at the time was bigger than what she dealt with, but then it's still something that we will be in together and we would go through together. So yeah, when it was about 30 weeks, I went for this appointment and she saw me. And then after everything, like everything is fine, like see the baby, that baby. Okay, this is just by the side. I think there was time to I think they wanted to check the when I wanted to find out the sex of the baby, my consultant asked me to run up and down because my baby was moving. She did not allow. She was just there moving. If I did consultant had to say, you have a mover. I'm like, well now I can see it. But yeah, that's just by the side. So when I went for this visit, this 30 weeks visit, after doing everything, she said, like of course they call me Didi. And then she was like, Didi, that you're doing very well and all that. I'm like, thank God and everything. I mean, that time was 30 weeks already. And when it was closer to the expected date of delivery, maybe not that close, like say it was still a few months, but at this time they could see where you can start seeing whether if for sure you're having a CS and all that. I mean, there was a talk about that already. But then she said that she can check my birth canal. As she's seen my birth canal and it's free. You can have a vaginal birth. When she said it, I was still looking like, she said, are you not happy? Like it's good news. Like of course with the CS, there is a risk of hemorrhage, of bleeding out because they cannot take out the baby imposter because there is the case of or there is a risk of hemorrhage. And because you need the uterus to contract. And then because there is that a person or somebody could bleed out. But now that you can have you're going to have a vaginal birth that's taken off that's taken out of the way together with the whole general risk of having a surgery, you see. And that yes, there's still the case of bleeding, but it feels like it's maybe lessened, I would think. So she explained me, it was then it made sense. Like your birth canal is free. We almost looked like it was something that she had not seen before or she had not heard of before, you see. And we had that appointment. I came home and that was it. We went on with it. A few days to um okay, so the expected date was like on the 17th of October. A few days to maybe ending of September when I had my appointment, then they said baby is fine and all that. However, the baby wasn't growing as much as they thought, or no, as much as she had been growing, like the chart was reading. So I had to be induced. And they started the process of induction, like two, I think it went on for like 2, 3 days. See, because there wasn't space. So I had to come for monitoring and then I would go back home. I came the second day for monitoring. I went back home. You see. And then the day they said, oh, there was space that come for induction. I went for the induction. They put this pessary thing. That thing was supposed to stay in for 24 hours, I would think. The first time after like the 12th hour, it was I couldn't take the of course the person will be contracting. I couldn't take that pain. You see, I told them to remove it, but because of the way I was feeling, I was thinking that there's no way I would not be dilated because you have to be a particular centimeter before they can help break the um, amniotic sac to let out the fluid. You see, so I was thinking I was already dilated or it was already opened or something. And when they came, they said I was less than a centimeter. I'm like, this day, is again. And then they said they had to put it again. Oh, they put it again. That one, long story. After putting out that one, I was 3 centimeters dilated, I think. And then they broke the they let out the water, and then the whole thing started. So I was going to have a vaginal, or I had a vaginal delivery, and my husband and my mother were with me in the delivery room. You see, of course, I had picked the song I wanted to. I wanted them to play. Before then, we're talking. I had an epidural, by the way, because you see, there is one thing that happened during this whole process, and that is VE. That thing, it was it is the most uncomfortable thing I've felt in my life. It was uncomfortable. I can't say if it was painful, but I don't know. Like when they put their hand to, and that's what they used to check whether you're dilating or how many centimeters you're gone and all that. So she had advised, or one of the midwives advised, that if that thing was uncomfortable or painful, because during the delivery that they would do quite a number of that thing, and so it's okay to have an epidural, which I had an epidural. See, and then, well, at that time I was still running mouth while it started. When I had the epidural, I could still talk and all that. Still laugh at my mom. When I was not when I was not having contractions, or not having contractions, it wasn't. I don't think it was that. I'm not sure. All the time they say you hold somebody, you will jack. But yes, more feel more hard contractions. Thinking about it now, only. But it wasn't serious of people running on that bed or running out or maybe holding your husband's neck, and I didn't have that. But then I happened, I don't want to talk. I don't want to even hear anything. Don't talk. No one should talk beside me. Yes, I had contractions, you see. And then at the time when I had the epidural, I wasn't feeling pain, but I was feeling pressure. So at some point, my baby's heart was, meanwhile, yeah, when I had the first persy, the reason why they had to remove it was, or the second time, was because my baby's heartbeat was dropping. Like the chart, it was dropping, rising, and everything. So maybe the contraction was much or something for her. So while I was getting tired and there, the her heartbeat was dropping again, and then the midwife told me that she's going to press a bell now, and then a lot of doctors would rush in, so I shouldn't be alarmed. So when they pressed the bell, like 10 of them rushed in. I was like, were they standing there? Were they waiting for this? You see, and then they knew what to do and all of that. But it was still fine to continue with the process. Because if anything was wrong at the time, or maybe with whatever they checked, and then something was wrong, you have to do an emergency CS. See, but then, so this happened like twice. But then we went on with it, and then they would say, "Oh, you're doing good. I can see the head." Pew. Once that one lady, I can remember, she said that when I push or when I listen, I should count to 10, something in my mind, and something like that. That's okay. Of course, when you're contracting is when you push to avoid you having tear. See, because if you push when you're not contracting, it's like you're expanding it yourself. When you're contracting, it's like it's expanding and you're opening the baby, you're pushing the baby out. Yeah. So she said, count to 10. You're doing good, Didi. You're doing good. Oh, baby's head. Look at the baby's head. See, my mom was the one going. My husband was just by my head, praying in tongues. He did not move from where he was. My mom was the one going up and down. See, so that time I was getting tired, and a doctor came in. He's Nigerian. See, and then he came in. I don't even think it was supposed to be attended. I think it was part of the people that came in when they came to check what was going on. But because he saw that we're Nigerians, I think he came back. Like he was coming and going. He was there. So he put his hand. So at the entrance of this and pressed it down. At least to help the baby come out. So he put his hand at one time to also check the position of the head, or check if there was anything stopping stopping the coming and everything. So he spoke about maybe doing an assisted delivery with forceps and something, or suction, I don't know. So while they were putting that down, I was like, remember I was telling my baby that during this pregnancy you defiled odd. So this particular one, they were not going to use fork. That's what I called it, to bring out your head. So work with me, or let's do this together. You see. So while they were laying that down, while he was doing that, I just heard, My dear brethren, it was a scissors. Yeah, yeah. I'm like, so yes, the man had to do an episiotomy, and then he cut it, and then not long after that, I heard head out, and my baby was there, and there was a cord around her neck, and then they removed it, and they gave me okay, yeah, they had to, is it cut the cord? They, oh, I don't know whatever they did. Just gave me my baby, and I carried my baby. I held my baby that had been moving inside me, the one that has been giving me, because yeah, she had hiccups while in the womb, while in my belly, and I could feel it. That baby that was in my stomach, that would be saying toop toop. I was holding that baby, the baby that I could have terminated. She looked perfect. There was nothing wrong with her. That small mouth. She was pretty. She is pretty. I held my baby. I carried my baby. She is pretty. By the side, let me say this. I mean, during the pregnancy, but it's nothing serious. During pregnancy, there was this comment by somebody that she hoped that my baby would be as fine or would be fine because yes, I was glowing and fine in pregnancy. And then she was like, oh, people that be fine are fine or glowing in pregnancy, that is most likely that baby is not as fine. It's like, so you feel as if you're taking the bits of your baby. But that's by the side. My baby was here and perfect, fine and beautiful. Beautiful. She was, she is. I mean, I'm talking about at the time when I was looking at her. I carried my baby. She cleaned up, or they cleaned her, and I stood up. I had a shower, and that was it. Guys, I had my baby, and I still have my baby. There was nothing when they came to do the hearing test. She had, but I see that, or I saw online that they said that maybe baby starts seeing from maybe, is it 3 4 months? No, it starts seeing black and white first, and then it starts seeing colors like a couple of months. My own baby, I think that she started seeing that day because my baby was just like this. Her head too was up, like she felt like an adult baby because she was looking. She was just very aware. She was, it's as if she could see you. That also, you see, and she was moving her head. She was, I mean, she's just, I don't know. She's just perfect. She's fine. She's fine. She's fine. She's fine. And yeah, that was this journey. All right, so that will be all for this episode in this series. Make sure you stay tuned and watch the next episode. There I'll be talking about the highlights for me and what I did during this journey. Make sure to like, share, and drop a comment. It's very important. And if you're yet to subscribe, what are you waiting for? Subscribe. See you guys in my next video. Bye.